Malnutrition as an issue can have serious implications on a community and individual, but how can we measure and quantify its severity? So what is malnutrition and what does it entail? The ESPEN guidelines define malnutrition as a state resulting from lack of intake or uptake of nutrients that leads to altered body composition and body cell mass, leading to reduced physical and mental function and impaired clinical outcomes from disease. Malnutrition types. There are 3 types of malnutrition: malnutrition without disease, disease-related malnutrition with inflammation, disease-related malnutrition without inflammation. Now that we understand what malnutrition is, let's take a look at some of the information needed to diagnose it. To measure malnutrition, we first must determine an individual's body composition. This can be done via a multitude of methods, but we will be going over 3 of these in this video: bioelectrical impedance, middle upper arm circumference, and hand grip strength. BIA uses the differential conductance of tissue components, assuming a hydration status of 73% of skeletal muscle. There is a higher resistance in adipose tissue, hence BIA can determine body fat percentage, which can be used to determine the fat-free mass index. Firstly, it is important for the patient to take off their footwear, as to ensure an accurate height reading. Next, the patient should step under the height measure with their back facing the ruler. The examiner will then lower the cap of the height measure to the patient's head and take a reading. Before the bioelectrical impedance is taken, the examiner should take care as to cleaning the equipment to maintain hygienic conditions. The examiner should then input the patient's height, age and sex before stepping onto the scale. Once the patient stands on the scale, they should lift up the handlebar with both arms straight in front. Once the BIA reading is complete, the muscle mass percentage, body fat percentage, and weight values should be recorded and used to determine fat-free mass. We can see that the calculated value is over 20.94 kilogram per cubic meter, meaning the patient has not met the cutoff guidelines for malnutrition. Middle upper arm circumference, known as MUAC. There is sufficient data suggesting MUAC gives us a good indication of body component stores, so it is a useful metric to help indicate the presence of malnutrition as these stores are reduced. Firstly, establish a midpoint of the patient's arm as shown in the demonstration, and simply wrap the tape measure around the arm and record the value. The given result, a value of 35.4 centimeters, is normal and not within the guidelines for the MUAC cutoff points. Hand grip strength. HGS is useful as it tells us about the muscle tissue component. Reduced HGS is a result of being in a prolonged catabolic state resultant from malnutrition. To measure this, have the patient squeeze the hand grip strength instrument. After the weight stabilizes, record the given value. The result of 46.9 kilograms is above the hand grip strength cutoff point. Low values indicated by the cutoff points suggest malnutrition. Patient is not malnourished. Diagnosis: if any of the 3 assessments yield below the cutoff points in combination with significant weight loss or a low BMI. Significant weight loss is defined as either more than 10% over a significant time or 5% over the past 3 months. Low BMI defined as 18.5 kilogram per cubic meter. To summarize, anthropometry assessments tells us if an individual has been in a prolonged catabolic state. Thus, the outline measurements are indispensable in malnutrition diagnosis.